Good afternoon, everyone. This is Jonathan Edelheit, the CEO of the Medical Tourism Association. I hope all you can hear me. We had some slight technical difficulties this morning. I appreciate everyone coming on the call. I know some of you are friends and business colleagues, and we have some new people on the call. And I'm going to be presenting today on the growth of medical tourism through self-funded insurance. And we're going to be covering domestic medical tourism and also international medical tourism. And as you will be able to see through the presentation, there's a Q&A box, so you can actually type Q&As, questions whenever you want, and if I have a chance, I'll answer them during the webcast, or I will answer them at the end. So, I want to cover a couple things before I get into some of the substance, and I know we also have some people that aren't familiar with self-funding. So I'm going to, start off by laying a little bit of groundwork about where healthcare in the U.S. is headed. Then talk a little bit about, what self-funding is for those people who aren't that familiar with it, who might be fully insured as an employer right now and not self-funded. Then I'm going to talk about the actual domestic and international medical tourism and go into some case studies of what's being done, and then some of the other aspects of engagement, utilization, technology that makes medical tourism programs successful. And I know self-funding is a very big trend internationally now, so the same tenets of what we're going over today in the U.S. self-funded market is going to be the same for anything that's happening internationally with self-funded plans. It's just that, the self-funded marketplace in the U.S. is the most mature, and as you'll see when I get into some of those statistics, it's really the biggest marketplace, and it's going to continue to grow. So, obviously, I think, we all know healthcare costs have been going up here in the U.S., and they continue to go up. If you look in 2003, the average cost for health insurance for family coverage was almost $9,000. And if you look at 2013, it was almost $16,000. So the cost is going up quite significantly. It's not really decreasing. The single cost about 22 years ago was almost $1,500. And in 2013, it was almost $6,000. And 10 years from now, it's supposed to double. So it's exponentially growing each year. And the Affordable Care Act and Obamacare, it has some very good positives, waiving pre-existing conditions, making a guarantee issue. If you had a health condition, you'd be covered. But, those things cost money, and it removed lifetime and annual maximums. It had other things that it included where senior citizens are supposed to be charged 5 to 6 times the rate of an individual, and now they're artificially charged 3 times, so young people's rates are coming up. And it's creating some adverse selection because the young people aren't coming onto health insurance under the Affordable Care Act because it costs too much. So you're having more older people and more sicker people in the plans. And because of those increased costs, there's more of a trend of employers moving to self-funding, and it's becoming much more and more attractive as each day goes on. So what we're starting to see as healthcare costs go up in the U.S., employers, I would say about 2 years ago, colleagues I know at some of the big insurance companies started telling me that for the first time ever in their health insurance company, they were starting to use the word innovation. And it was that the carriers realized that costs were unsustainable and they couldn't keep doing what they typically have done in the past. And if we look at in the U.S. marketplace, for example, what is going to reduce health insurance costs and healthcare costs? There really isn't much anymore. They've tried high deductible plans, and high deductible plans haven't worked. We've tried consumer-driven plans, and that hasn't worked. The healthcare transparency side is very difficult because hospitals charge different prices, doctors within hospitals charge different prices, so it's even difficult to get a hold of healthcare transparency. And then there's other innovative things like corporate wellness. And I'm heavily involved in corporate wellness here in the U.S. and overseas, but it's a multi-year process in corporate wellness to see if you can get return on investment. And then it's a challenge to be able to really show the evidence of the ROI. And also, it depends on what vendor you're using, what wellness program you've implemented. So there's a lot of different challenging factors. So the reality is, if you look at a core, what could instantly reduce healthcare costs immediately in the U.S. health insurance market and within self-funded plans, there's two. There's domestic medical tourism and international. And domestic, it's not new. When I was running a national third-party administrator and doing self-funded plans, many years ago, we were doing it, but we called it steerage. But now it's taken the term domestic medical tourism. It's more formalized, and most of the large employers have implemented in the U.S. And I think we're going to see a trend over the next couple of years of a lot of mid-size and then smaller employers implementing domestic medical tourism. And it's simply patients traveling within the U.S. seeking non-emergency surgical care and traveling to different destinations. It could be someone from LA going to San Diego, from LA going to Cleveland, from someone from Miami going to Boston. And it's a very big growing trend. And I'm going to be going into some case studies later in the presentation about employers who have implemented domestic medical tourism. But they're doing it for two reasons: either quality and better outcomes and bundled pricing and rates, or they're doing it based upon lower costs. And then you have international medical tourism, which is patients traveling abroad, overseas, to other countries to get either higher quality or, once again, more affordable care. And both of these are going to really take off quite significantly in the next couple of years. As we move towards the end of the year, and when we see that the employer mandate is upheld and the employer fines are upheld, employers are going to say, hey, do I pay a couple $1,000s in a fine, or do I offer my employees comprehensive health insurance? For those that aren't offering, and to those that are, they're going to be looking at, how do I keep my costs down? So we're going to see, I think, a much faster growth rate over the next couple of years in both the international and domestic medical tourism, because it's the only thing where, when employees do it, it's instant savings. It's not theoretically. It's not something you're hoping you're getting savings from in the future. So for those of you who are on the call who've always, you're an employer, an HR professional, director of benefits, CFO, who's always been fully insured. Obviously, self-funding is a new concept. It's not really for the risk averse, because there is risk when you go self-funding. It's where you as an employer assume the direct financial responsibility to pay for the cost of all your medical claims. And you typically will contract with a third-party administrator or an insurance company to provide the administrative services and do everything that an insurance company would. Pay the medical claims, do the customer service, contract with the medical network, print ID cards, and in a lot of cases, you'll buy stop loss or reinsurance coverage to protect you from the catastrophic losses for individuals or for the group as a whole. Where obviously, if you're a fully insured plan, you have very limited risk, but you're paying a very specific, amount each month and each year. So some of the, the benefits of why we're seeing a growing trend towards self-funding is that there are certain things that you don't have to do when you're fully insured. You have to, by law, when you're fully insured, have certain reserves set aside, pooling charges. There's overhead and profit. There's commissions paid out. There's premium taxes. And there's certain benefits that you're required, healthcare benefits you're required to provide, which you're not when you're self-funded. Obviously when you're self-funded, there's aggregate insurance, there's the stop loss or the specific deductible, you have admin charges, you still will have commissions and certain taxes that you'll have to pay, but you don't have to worry about paying for the profits, and you're not required to pay the very certain benefits that you are required to cover under the fully insured. So in the end, your costs, should and could be less. So, to go over some statistics in self-funding, because, it's interesting, a lot of people don't talk about these, meaning even if they're self-funded, there's not a good grasp of how big self-funded is. But 61% of covered workers in the United States are in a self-funded medical plan. So that means a majority of them. And the number has grown. So if we look, going back in time, in 2000 it was 49%, 2005 it was 54%, 2010 it was 59%, and now over 61%, so a constant trend of it growing. And when we look at covered workers in large firms with 200 or more workers, 83% will be self-funded, where if it's smaller firms, under 200 lives, it'll be 16%. But that's a huge number. 83%, 200 or more employees are self-funded. And, and then when we look at this also, in anticipation of the Affordable Care Act, before it was passed, 6% of companies that were fully insured reported that they plan to self-insure going forward. And it's because they're going to end up paying less. So if a company has over 5,000 employees, it's estimated by 2016, 97.4% of them will be in a self-funded medical plan. So almost, that's pretty close, almost 100% of large employers will all be self-funded. And the beauty of that is when the employer is self-funded, as for those of you who aren't aware, is you get to make instant decisions. There's not the bureaucracy, there's not the compliance that happens with big insurance companies. If you want to implement domestic medical tourism, you want to implement international medical tourism and do something innovative, you could do it like that. It's a decision that's made internally, very simple. You add a short paragraph to your plan document and summary plan description, and the benefit is implemented. Where when you're dealing with an insurance company, it can take months, it can take years to get them to actually do it. So let's go over for some of you that aren't very familiar with self-funding, and I apologize for those of you that are experts that are on the call. You have stop-loss coverage, and this is going to be important for some of the examples I do a little bit later in the case studies with what's been going on in medical tourism with employers. So you buy stop-loss deductible, and that's where you're paying. The employer pays up to a certain amount on each individual employee, and then the reinsurance company has a stop-loss deductible, and they say, over this amount, we'll pay everything. Usually there's a cap on it. It could be $1 to $2 million for that individual. So, for example, and that specific deductible changes based upon how many employees the company has. The more employees they have, the lower the stop-loss deductible is. So let's just say for sake of this argument or for this webcast, an employer has a stop-loss deductible of $75,000. This means the employer pays the first $75,000 on each individual employee. And above, once the medical claim is $75,000, then the reinsurance company pays everything above that. So this is why domestic and international medical tourism are attractive to employers. Some employers might have a $100,000, $200,000 stop-loss deductible. So they know if somebody has if you have a $100,000 stop-loss deductible, if you have orthopedic care, spine surgery, a heart procedure, you might have to pay up to that $100,000, and in some cases are guaranteed to do it before the stop-loss insurance company, reinsurer, will come in and pay. And so therefore, by implementing international or domestic medical tourism, if you bring that claim down and you get it down to $50,000, for example, then you just saved out of your company's pocket $50,000. And so that can have a major impact on your healthcare expenses for the year, what you paid towards your health insurance, but even more so, it actually controls your costs going forward because your medical claims will end up being less and less each year. And also, you'll have lower rate increases from your stop-loss carriers. Just like normal insurance, they'll give you rate increases each year. It could be a couple percent, could be 10%, could be 15%. But if they're not getting, the reinsurance company's not getting their claims on these big dollar amounts, then you're obviously going to end up paying less for your stop-loss and reinsurance premium than you would. And then the other aspect of the self-funding plans are aggregate stop-loss. And this is a worst-case scenario for the entire employer, for all their employees. I just got a comment from Judith that she said she lost audio. So if anyone else has lost audio, please type that in. So the aggregate is the worst-case scenario. So if all your claims go bad, then and your whole plan hits a certain amount. For the sake of this webcast, let's say $2 million, then the reinsurer comes in and pays for it. So what services are employees going for in medical tourism, and then what are other procedures people are going for? So for insurance purposes, we're seeing people go for orthopedics, hips, knees, back and spine, cancer treatment, heart procedures, transplants. And when we say transplants, it's where there's a donor available. Obviously they need to have the organ available. And then A lot of people don't know this, but some dental carriers have been covering dental tourism and covering implants, veneers, and crowns overseas. The AMA, has dictated weight loss. Obesity is actually a disease. So now we're seeing more employers covering for bariatric procedures because they realize it's going to help with heart and diabetes and other claims that will come to, later. And then some of these procedures on here aren't for employers, but people are traveling for stem cell treatments, cosmetic surgery, infertility. Some employers cover infertility, and when we look at the stem cell side of it, you look at people who've gone overseas for stem cell treatment. Steve Jobs from Apple, Farrah Fawcett, the actress, Peyton Manning, the football player. So people will travel where there's quality. Now, one of the things to look at when we look at cost, because some of this is cost-driven, and when we look at the cost of care in the U.S., and you look at the cost of care in some of these other countries, the cost can be very high. But what this chart doesn't show is domestic medical tourism. So, that trend of U.S. hospitals and facilities that are creating set pricing, and it's a package price, and it's lower. So these prices are more on the high end for the U.S., but you'll see if we go down to hip replacement, $50,000, where it can be anywhere from $7,000 to $14,000 overseas. So there's a huge savings. Knee replacement, where the knee replacement could be almost $50,000, but once again, almost $6,000 to $14,000 overseas. And it's so difficult in the U.S. to get pricing for procedures, because as I said, it varies based upon the hospital, the doctor doing the procedure, everything. So you could have two hospitals in the same city, and one's charging $40,000 for a knee replacement, and another is charging $100,000. And then you never know what the real cost is going to end up being, and you don't know if complications occur, what it's actually going to be. So the hospitals that are the leaders in both domestic and the international medical tourism are saying we're going to be very transparent with our pricing, and we're going to tell you exactly what our cost is, and that covers everything. And some are even going further and saying we will cover complications. So we're going to get it right the first time, take a multidisciplinary approach to the medical care, and if we don't do it right first time, you don't pay anything extra. So it's all about, I think, it's about consistency with cost and knowing that you're consistently going to know exactly what you're paying, and you're going to get the consistent high quality. So employers and both insurers are tired of a lack of consistency with pricing and a lack of consistency with quality. Because if you actually if you're right now what's happening in 99% of the cases, our employers are saying, here's your medical PPO network, choose your hospital, choose your doctor, go for surgery. And they're getting someone doing it for a procedure with that one employee's paying $50,000, the cost is $50,000, another it's $100,000, another it's $150,000, and some are having complications where now the claim is $250,000. Some are coming back to work within a couple of days. Some are taking 2 weeks to come back to work. And this affects, it's not only the hard dollars, but it's productivity, absenteeism, presenteeism. How fast does that employee get back to work? How many times does he have to be out of work for complications? So they're demanding more. And so it's all about lower healthcare costs and a sustainable health insurance program with the key word being predictable costs going forward. This is what domestic and international medical tourism is, predictability. And it's focusing on only choosing the best doctors and the best hospitals, and then steering their employees to say, please go to these doctors and hospitals because they're the best. And as I said, they'll return to work faster and better outcomes. And if we look at the cost benefits to employers, it's pretty high. I showed it there before, but let's say, if they're traveling within the U.S., literally we're seeing cost savings of anywhere from 30 to 80% versus letting them choose their own doctor and hospital in the U.S. And then overseas, we're seeing the cost can be as little as 30% of what it would have been in the U.S. And if we look at, there haven't been any statistics about domestic medical tourism and surveys of would you, as you live in Dallas, Texas, would you travel to another city in the U.S. for medical care? And no one's done that study, but they've done it multiple times for Americans leaving the U.S. And so the reason why I'm going to go into those stats is imagine how much stronger those numbers would be domestically. Because obviously, if you're willing to pack your bag and leave your country for care, you're definitely going to be even more likely to travel within the U.S. But with Gen Y, they found 51% would be willing to travel to another country. Gen X, about 42%. Baby boomers were around 36%. Males, 44% would be willing to travel, and about 33% for females. Hispanics, though, 51%. Caucasians, almost 38%. Asians, 56.8%. So it's really interesting to see because it's based upon your level of confidence, your cultural background, ethnicity, and everyone who knows in the U.S. is, I believe it was this year, that Caucasian babies are in the minority now. So it's a multicultural, diverse group, and that means that the majority of this multicultural group, they're willing to travel overseas for care, and they're willing to travel here in the U.S. So what is the benefit to employees? So a lot of times, people are saying, why would an employee go overseas for care? Or why would they travel and leave their hometown and go from Atlanta to LA for a medical procedure? So it's multiple things. The first key thing is no out-of-pocket expenses. So the employer is saying, we're going to waive your deductible, we're going to waive your copay, we're going to waive your co-insurance, and we're going to allow you to travel, and we're going to allow you to take a companion with you and pay your food and everything, food and travel expenses to go get that treatment. So waiving that copay and deductible, depending on what plan they have, that can be a couple $1,000. That can go as high as $10,000 or more. So that is a huge impact on an employee. So let's say you're talking about an employee making $40,000 a year, and you're telling them that they're going to save anywhere from 10 to 25% of their annual salary if they go get this procedure done somewhere else than locally. That is a big financial incentive. They know there's going to be no wait times. They're going to get in right away, and there's going to be a very high level of quality. And their doctor is one of the top in the industry. So what's really neat is I see more consumer-driven engagement with employees with domestic or international medical tourism than I see with any other type of consumer-driven plan. Because imagine the questions and the motivation an individual has. Put yourself in the shoes and say, if it was you. And I know if it was me, and I had a treatment plan for my local knee surgeon. And I went and I looked at a knee surgeon in LA, and I looked at a knee surgeon in Costa Rica and Singapore. For the first time ever, I'm going to start really peeling back the onion. And where did you go to medical school? How many knee replacement surgeries have you done? What's your complication rate? And you're going to start making really intelligent decisions and thinking like you never had before. Because if my local doctor here in West Palm Beach, Florida, has done 100 knee replacements, and there's a doctor in LA who's done 300, and there's one in Costa Rica that's done 500, and there's one in New York who's done 700, I'm going to lean to the one that has the most experience and the best outcomes. And I'm going to start really thinking about that, where I know when I've been to the doctor in the past, when I wasn't doing this, a lot of patients don't start delving into that. They don't go to, well, how many procedures did you perform? They don't think about that. They just think about, you're the local doctor, you were recommended, I think I like you, and I think you'll do the procedure well. So that's the benefit for the employees. And then one other thing, and I'll go into this with the case study, I'll do it in a little while, is they're also giving, in some cases, cash to the employees. So they're giving them a check for a certain amount, a couple $1,000s, or a percentage of the savings. And some, employers can do whatever they want. It could be an extra 1 week, 2 weeks of vacation pay. It can be, it can be anything that employer decides to do. So I think that's really key, because you're talking about not just saving deductible and co-insurance and the out-of-pocket expenses, but getting paid also. It looks like the image in here isn't showing, but we're going to play a little video at the end. But one case example here is HSM. And HSM is Hickory Springs Manufacturing Company. They're a member of the Medical Tourism Association. They're a manufacturing company in North Carolina with a couple thousand employees. And we spent several months working with Diane Sorter's team in Nightline and ABC News in putting together the first story of an employer going on record and saying, I've been doing medical tourism, and in this specific case, international medical tourism. So this is something that, it's not a theory, it's not something that people are talking about may happen. It's something that has actually been happening, but no employer really wants to be the first one out to say, hey, I've been doing this, and it's really successful. Usually if they do it, they kind of do it very quietly. And I know HSM came out because they were just tired of the cost of healthcare, the quality and the outcomes, the service delivery, and they wanted to tell their story about what they've been doing, not just for a couple months, but for 5 years. So I think this is critical in looking at a program like this. So for 5 years, they sent almost 250 employees overseas to India and also to Costa Rica, and they saved $10 million. So this isn't a short-term case study. This is a program over 5 years, consistent quality outcomes, consistent significant savings. And that makes a big impact to a company that's a manufacturing company. And I think what's interesting is there's been a corporate culture shift, and now the employees love traveling overseas. And now they have, I think what they did in 5 years, they're going to do probably in the next 12 to 24 months, because now, it's within the corporate culture. Everybody loves the outcome. They love the experience, and all the employees within are referring and saying, don't go to the local doctor, because if you travel, you don't pay anything out of pocket, and then you get a check. So in their case, for example, if you look at a knee replacement costing almost $60,000 for them, in Costa Rica, the package price with airfare, hotel, everything else was almost $23,000. So there was a very big significant savings to HSM as an employer, and then the employee saved significantly also. And they're getting excellent doctors, and they're returning to work fast. And then for North Carolina, they had one of the employees go for gastric sleeve surgery for weight loss, and it would have cost $30,000 in North Carolina. Ended up costing almost $17,000. So the employer saved about $50,000 on both of those employees, and the employees received a $2,500 check from their employer on top of all that. Now let's look at domestic medical tourism. And I always like to use Walmart as a case study, but you have a lot of them doing it. You have Intel, Boeing, a lot of the big employers in the U.S., they've implemented domestic medical tourism. And Walmart specifically did it because they wanted improved quality of care for their employees. They wanted to make sure they get the right care at the right time. And this is something I apologize because I didn't cover this earlier. I think the most fascinating thing that we've discovered, and once you get into doing domestic and international medical tourism, you will discover, is that there's a very large portion of employees who are getting orthopedic care, heart procedures, other very expensive procedures that they do not need. So they're getting misdiagnosed, or there's a less intrusive, less costly alternative treatment. And these numbers are high. We're talking anywhere from 10% to where we're seeing sometimes 50, 60, 70%, depending on the doctor or the actual procedure. So all these employers have learned the secret that if you're sending your employee to the best surgeon, he is not going to operate just for the sake of operating to make money, and he is going to look at any ways he could avoid operating if there's alternatives. So they're catching a lot of cases that are being turned away because of misdiagnosis and alternative care. And this is the most, I think, best benefit. And once employers implement it and they start seeing this, they love the program. You would be shocked to hear, how many billions of dollars a year the U.S. system wastes in misdiagnosis and treatments that aren't required. They're also finding they're getting a higher value out of the procedure and a lower cost. So, for example, some have partnered, like Lowe's, partnered with the Cleveland Clinic for heart procedures, and they got a bundled package price that was the final price, and that was it. And they actually found that the outcomes were better, the complications less, the return to work faster, and the cost was cheaper than employees going to hospitals in their own cities, in specific cities and states around the country. So imagine that. You're actually contracting with one of the best hospitals and surgeons in the world, and you're actually getting a lower cost than you would sending them to a lower quality hospital with a less experienced surgeon. I think that speaks volume. So there's a lot of long-term benefits. So how did Walmart do their Center of Excellence program, the domestic medical tourism? It's voluntary. So whether it's domestic or international, it's letting people choose, do they want to travel? And if they want to travel, they get their incentives. If they don't want to travel, they can get care locally. Everything is paid at 100%. Walmart, like the other big employers, no deductible or co-insurance, and they're paying for travel, lodging, and food for the patient and the caregiver. And what was the criteria Walmart had in choosing the hospitals they were going to work with? Only high-cost procedures, because it doesn't make sense. You're not going to send someone to travel to another city, another state, another country over a procedure that costs $5,000 where you're going to end up spending more than you would locally. So high-cost procedures, high variability in cost. So when I was giving that example of a knee procedure being $40,000 here, $70,000 here, $100,000 here, that's what they're looking for, is where the cost is all over the board so they can get that predictability. Evidence-based medical standards of care are published so that there's a system to how every procedure is done, and where travel is possible, not urgent. You're not taking someone who has a cardiac procedure who needs a procedure in the next 5 hours and putting them on a plane. So Walmart, when they launched it focused on cardiac and spine procedures. And the projection that they expect to save employees is anywhere from $5,000 to $12,000. And for cardiac care, they chose the Cleveland Clinic, Geisinger, Scott and White, Virginia Mason, and for spine, Mercy Hospital, Scott and White, and Virginia Mason. Now, to jump into an international medical tourism case study, another one is Blue Lake Casino Hotel. The director of benefits here is Jack Norton. He's a great guy. He typically speaks at our conference, really understands the value of medical tourism. And Blue Lake Casino has a corporate culture that optimizes wellness, coordinated care, and cost-reducing coverage options. So they have a bundled benefit plan that includes medical, dental, vision, pharmaceutical, and wellness. And a few years ago, they added medical tourism to its plan, and that allows the 370 employees and their dependents to use medical tourism if they'd like to. So, their case study right now is they have an employee, Bruce Ryan, who's a 59-year-old construction manager, who's now back home in California following surgery to repair his torn rotator cuff at a hospital in France. And so they had an employee travel to France. And this is the interesting thing with whether it's domestic or international medical tourism. It's about giving the employees multiple choices. You don't just choose one hospital, one city, or one country. Everyone is going to feel comfortable to a different destination. They're going to have their own reasons and perception about where they're going for care, the hospital, the city, the country, and so you got to give them choice. So the 21-day trip included a successful surgery, post-op recovery, aftercare, sightseeing excursions with his wife to the mountain range, and 50% off the $32,000 that would have cost his employer had they had the procedure in the U.S. And I love here the fact that, they're sharing in this case study, Blue Lake, a tour of the mountain range, because you'll get some people who will try to be critics and say, people aren't doing tourism, whether they're traveling from one city to another or to another country. It's totally not true. People are engaged in tourism. They love tourism. They're doing tourism that their doctor says they recommend and that they think is acceptable based upon the procedure that they're going through. So we've seen all kinds of tourism happen, and people love packaging this with tourism. So if we go back to, I already mentioned Lowe's partnering with the Cleveland Clinic. Pepsi is partnering with Johns Hopkins. There's a bunch of different domestic medical tourism case studies. This year at our annual conference this September, we're actually having a domestic medical tourism Center of Excellence roundtables, bringing in a lot of the big U.S. employers to talk about what they're doing in domestic medical tourism, what works, what doesn't, and where they can really start collaborating. But Pepsi rolled theirs out in 2011 and specifically chose Johns Hopkins in Baltimore for cardiac and complex joint replacement surgeries. So once again, high-cost procedures, high variability in cost. So one of the things that I'll go over, and it's not actually in the slides, is the engagement, and the engagement is extremely important. So with the engagement, there's a big gap missing, and what I mean by a big gap is some employers are implementing medical tourism, and they are not doing anything to educate the employees in the benefit. So they're saying, you have a medical tourism benefit, go do it. You're going to save money, the hospital is great, but they're not giving the employees the hard material, whether it's in print form, whether it's in PDF, whether it's a portal on the employer's website, that really delves into what's the quality of care at this destination, who are the doctors, what's the safety of traveling, what are the outcomes, what are the benefits of going versus not going. And this is a big disconnect I think I see in the industry, because with that, you'll end up having a lot of utilization. So a great example of who's doing that is HSM out of North Carolina, because they have a high volume of patients going. And then what you also see from that case is that hospitals, it's important for hospitals to build relationships with their clients. So in the case of HSM, they were sending a lot of patients to India. But those hospitals lost those relationships, and now they're sending most of their patients to Costa Rica and also shortly Puerto Rico. So employers want great relationships with their hospitals, just as the hospitals should be having great relationships with the employers or the buyers, or they're going to lose them. So another gap in the industry is having a technology system as an employer that streamlines your medical tourism program and protects HIPAA privacy. Or if you're in Europe, it's stricter privacy laws. So this is a gap that's missing in the industry. So almost, I would say, a majority of all medical tourism that's going on right now is not compliant with privacy laws, and this is a big issue. So people are saying, my plan is HIPAA compliant, but it's not. It's being handled in Microsoft Excel, Microsoft Outlook, and Word, and by paper and pen. So if you're an employer, you obviously don't want to get hit with a HIPAA fine. And those are growing because, I deal with the HHS, DOL, IRS, and some of the top national attorneys on healthcare reform and ACA issues. And a lot of people don't realize that the Affordable Care Act is underfunded. And one of the ways they're going to fund it going forward is through HIPAA fines. So you need a technology platform that's common for the payers, the employers, the healthcare providers, and the facilitators that complies with the privacy and security and creates kind of its own ecosystem. And where employees can transfer medical records. So, if you're on this call with an employer, you need to make sure that you demo the system, whoever you're working with, whether it's a hospital or a facilitator who says they're doing medical tourism and they have a system in place, because many don't. They're using a CRM, or as I said, Outlook or email. And they're, I've seen crazy stories. You see it all the time of medical records, telling the patient, put it in Dropbox. HIPAA violation, where hospitals or doctors or others are accidentally emailing us here at our organization someone's medical records because they're just using Outlook to communicate and transfer things between. So you can have, there are systems out there, such as, like HealthLight has a global patient management system that's all one system. It's got the portal to communicate to the employees, the portal for reporting for the employer to track everything, the hospital synced in there, the medical records, and all communications go through one system. And it's all through that. So it's not through Outlook, it's not through Excel, it's not through paper and pen. It's all through one secure platform. And that's really key. Because this is just a little slide about breaches in privacy going on with hospitals and fines. And I know the United Kingdom is really strict, like the rest of Europe. They're almost more strict than the U.S. and they hit hospitals with fines for breaches all the time. There's a lot of U.S. employers that are getting hit right now with fines for HIPAA violations where it's a standard $1 million fine. Standard $1 million fine. So it's really serious. And if you're an employer, that will destroy your whole program. And if you're a healthcare provider on the call, you can pretty much guarantee you'll be out of this business, once you have one HIPAA violation, because no employer or insurance company is going to want to work with you going forward. And a platform like that can be used to have all the engagement and communication to your employees, because it actually can store all the medical procedures, the doctors, the hospitals, and then allow the employees to directly engage them. So obviously, if you're an employer and you're implementing medical tourism, you want to make sure that the hospital you're dealing with and the doctor you're dealing with deals with traveling patients, whether, we can call them international patients or domestic patients, because there's a lot of facilities that will say, oh yes, we take patients, but they don't have a dedicated international department or domestic department, and they don't have the right services and protocols in place to have a consistent experience and very positive outcomes. So we're seeing a really big problem with service delivery, where people are getting traveling patients, but they don't have the infrastructure in place. And in some, they know they don't, and some they think they do, but they're missing a bunch of the pieces, and so you have service delivery issues. So you really want to partner with the ones that are really doing it right. I'll skip through some of these other technology on the technology side, and anyone can watch it to look through it later. But reporting, I think this is key for an employer. If you're going to put in a medical tourism program and you have that technology platform that's going to handle everything, please make sure you're checking the reporting, and because with that, if you get reporting, you can review and analyze your whole program. You can actually look at how many employees actually went ahead and made requests for quotes to travel for procedures, because maybe they didn't go, and then you can go back and engage them. Well, why didn't you go? Was it we didn't provide the right information? Was it we didn't engage you properly? Were you not comfortable going to that destination? Did the hospital not get back to you in time? And also, you can see how fast the doctors are responding to your employees, how fast the hospitals are responding to your employees. You can see your cost savings. You can see who's in the pipeline to go and what cost savings there might be and things like that. And you can do a lot of reporting on financials, and that can allow you to make intelligent decisions going forward. And it can make you be able to have better intelligent decisions with the with the C-suite to get more support for the program. And it also, you can have reporting to show employees, this is how our program's doing. This is the impact it's having on our company. With that, I know we're getting close to kind of running out of time for our presentation. We got about 10 minutes left. Is that it's domestic and medical tourism. If you're an employer on this call, you really, if you're not doing this, you shouldn't be doing this. When I ran my TPA, we were doing this in the early 2000s. Why should you be your employees don't necessarily know any better. They're not going to go ahead and say, I want to go to the Cleveland Clinic. They're not going to even know how to initiate that process. But you as an employer could go to them and say, hey, here are 5 or 10 hospitals, and here are doctors at these hospitals that they're the best. Here's the number of procedures they've done. Here are the outcomes. And you can choose to go to them. And if you go to them, you're going to save your deductible and co-insurance, and we're going to give you cash. And if even if you don't go to them, use their experience and what they've done to vet your local doctor and make an informed decision for yourself. There's no reason why every employer shouldn't be doing it, and they will over the next couple of years. And the impact on the bottom line and the savings of your plan is going to change. And I think that you can make your company like an HSM, where you change the whole corporate culture of it. And it's whether your employees are going from Atlanta to LA, Atlanta to Boston. By the way, I'm just using Atlanta as an example. I'm not saying they don't have good quality health care, but the patients are traveling from anywhere to everywhere, or they're going from Tampa, Florida, all the way over to, Singapore or Taiwan. Everyone has access to the internet now, and people are more informed than ever before. But what they're looking for as an employee is for you to provide them this information. And we're going to be doing a very big engagement this year, getting out to U.S. and international employers about the importance of implementing this and teaching them the cost savings, and start putting together more case studies and working groups of employers. And we're going to be doing that through workshops and roadshows and events we're doing all over the U.S., all over the world. And then also we're going to be doing it through we have a very large database, but we also have a very large social media presence. Now, literally as of today, we've made a lot of really strong partnerships this year, and our organization is growing really fast. We reach almost 1 million people through our database and our magazines. But on social media alone, LinkedIn, today we have almost 500,000 people following us in about 30 different groups who are members. So if you're not a member of our group, reach out, go join them. Whether it's our medical tourism group, HR group with almost 200,000 people in it. We got our benefits, health and welfare professional group with almost 30,000. We have a self-funding group with several thousand, employers and players in the industry. Come join and engage in the discussion, but we're going to start pushing this content out, and we'd appreciate you on a local level of also sharing it, with your local HR associations and colleagues. So if you're an HR professional on this call, or an employer, we want to invite you to come out to the 7th World Medical Tourism Congress this year. It's integrated with the Employer Healthcare and Benefits Congress. It's the biggest, really, benefits and insurance and healthcare conference in the country. We got about 2,200 attendees this last year. We're shooting for about 2,500 to 3,000 this year, and it's a lot of it is all case study driven, where you can learn a lot of different things. And if you're an employer, HR professional, you can apply for a free pass. So please just email me afterwards. You can get a $2,500 pass for free. But if you email me, I'll send you the free code. And then for people who are on the call, we have a special offer if you'd like to attend our conference. It's September 20th to 24th in D.C. It's a discount code where you'll save $1,000 off registration. So you can go and get certified now and get your certified medical tourism professional designation. It saves $1,000 and come to the conference for free. It's $1,500, and you can use at our conference website, which is medicaltourismcongress.com. the code 2014 Reg with CERT, and that will also give you access to all the medical tourism sessions, all the employer healthcare Congress and benefits sessions. So, and this is what's great about the conference is there's networking software. So besides going into some of the sessions with case studies, we're going to have, I think, almost like 200 to 250 speakers, a lot of keynotes, a lot of international and national leaders. But you can schedule networking meetings with, with people at the conference that you want to do business with. So if you're an employer, you can look at all the hospitals coming from the U.S., from around the world, connect and do business meetings, and you can get a lot of leads and other opportunities. And for any hospitals who are on the call, feel free to reach out to us. I can connect you with Charlie if you're interested in attending or sponsoring. We rolled out guaranteed networking meetings this year, so if you sponsor, we'll actually set up one-on-one networking meetings with your target clients. So if anyone has any questions with medical tourism, international, domestic, implementing it, guidance, help, anything like that, please let me know. I'd be happy to to walk you through that whole process. I have there's one question that just came in, and let me see about that. And my screen is a little small in the Q&A. Maybe my Thomas can come in here and help me expand it. But the question is, what is the best economic model to profit as a domestic medical tourism coordinator? Do you charge the company a fee per case, or what is the best suggestion? And with that, so this is the question. So if you're a medical tourism coordinator or a facilitator, like someone who's going to go and help employers implement this, and it's a really great question. So I really appreciate you asking the question, because I think it's all about transparency, also to the employers. George, I appreciate you asking that. And so if you're an employer, there's a facilitator or a coordinator who helps the whole process, and obviously they need to get paid. They're a business, and when you go to use them, be very careful who you work with, because there are great ones, there are average ones, and there are ones that they'll steal money, that they'll send your employees to bad doctors, bad hospitals. There was recently just an Al Jazeera episode. Not that probably a lot of you watch Al Jazeera, but if you Google Al Jazeera medical tourism, there was a two-part story they just did on this topic. So facilitators will make, there's a couple different models of revenue that they'll make. So one of the models is they'll make a commission from the hospital, and that could be 10% all the way up to 20% on each procedure. Some employers are happy with that. Some don't want that because they feel like, oh, well, maybe then the facilitator will have an incentive to pressure employees to travel for care. So some just will want to pay a flat fee to the facilitator, not a percentage of the actual procedure or a percentage of the savings. And then there's another model of charging a per employee per month basis to the employer, just like employers are used to who are self-funded with their national medical networks. You know, where you might be paying, you know, Beach Street or others, $3 per employee per month or $5 per employee per month. So maybe that facilitator comes in and charges anywhere from, you know, it could be $1 per employee per month to a couple dollars per employee per month. And that's a set monthly amount based upon the number of employees. That doesn't change whether they actually, you know, it doesn't matter if employees travel or not, they're getting that consistent fee. And I actually prefer the PEPM model because what we've seen with a lot of models that have been implemented where facilitators have gone to employers and, you know, said, hey, listen, I'll give you medical tourism for free. I'm not going to charge you anything. Offer it to your employees. And I'll just make money on commission. Is the facilitator is not getting any revenue in to actually have the funds or resources to actually go and educate and engage the actual employer's employees, and therefore there's no engagement, and then there's no utilization. And then in the end, the employer says, hey, none of my employees have traveled, they don't really care about medical tourism, and then on the facilitator side, you're saying, hey, you know, I put this in for free, and I have no patients to travel. And the reality is you've got to make something so that you can spend the money on the resources to educate the employees and engage them to make them want to travel. But I'm really excited about medical tourism. I've loved it, you know, ever since I helped co-found the Medical Tourism Association in 2007. It's all about consumer-driven education, giving people choices and letting them really understand about the quality of care and their outcomes. And it's just really neat to see how the industry is changing. You know, like Bupa, the largest international insurance company in the world, they're moving towards this model. And it's not they're thinking about it, they're doing it. You know, and they're getting hospitals on board with transforming themselves, doing bundled pricing, transparent care, all these different things I was talking about before. And they're going to send their patients in the future to those hospitals that do it. And all the other international insurance companies are going to follow. So this is going to be 3 to 5 years from now, not just in the U.S., but globally, this is going to be the model of how business is done. And there's going to be hospitals who really get it, who get on board with it and are the leaders and get all the patients. And there'll be other ones who say, you know, I don't really have to worry about it. And they're not going to get any of that medical tourism business. And on the employer side, the employers who get it are the ones that are going to get the cost savings and be able to continue to afford to offer benefits and health insurance to their employees. So with that, I know we kind of run out of time. So any questions anyone has, please email me directly at Jon@medicaltourismassociation.com. If any of you want that code to register, please let me know. Any of you would like to collaborate going forward, you know, let me know different ways we can collaborate. And then any of you who are on the call who aren't MTA members, definitely encourage you to join as an MTA member. And if you're not an MTA member, then please work with an MTA member. You know, we really work with our members to develop ethics, standards in the industry, best practices, and it's good to support those that are really trying to grow the industry in the best possible light. So I want to thank everyone for calling. We're going to make the PowerPoint and the webcast available. It usually takes us about 48 hours, but we'll email it all out to you. And there's also a self-funding white paper that you'll have access to. So if you want to email us, we'll provide you the self-funding white paper on self-funding and medical tourism. So thanks for joining us, and everyone have a great week. Take care.